Hi, everyone. My name is Olivia DeLong. I am the Senior Health Editor here at BabyCenter.com. I am so excited to be joined today by Hearing First and our amazing experts, Dr. Zwollen and Dr. Caraway. We are going to be talking about the importance of hearing for brain development, language, and learning. We collected questions from our Baby Center community, and we're going to dive into those after the doctors introduce themselves. Welcome, Dr. Zwollen and Dr. Caraway. I'm so happy to talk to you today. I'll go ahead and let you guys introduce yourselves. And like I mentioned, we'll get into the questions after that.
Yeah, thank you, Olivia. I am super excited about this conversation today and having the opportunity to answer questions that came from moms in the community about hearing. I think the most important thing to know about me is that I'm first the mother of two grown boys, and I happen to have the glorious privilege of being a grandmother to three little ones. Along that way, I also happen to have a PhD in speech language pathology, and I have the humble privilege of getting to lead the Hearing First team as CEO. The Hearing First is about supporting families who have babies who are born deaf or hard of hearing so that they can reach their full potential in life. And we do that through raising awareness of the importance of newborn hearing screening. We provide online education to parents as well as to and the professionals who serve them. And then we provide an opportunity to connect and with one another, a family-to-family support community online, as well as a professional learning community. So it's a humble privilege that we get to walk this journey to support families who are wanting their babies to listen and talk and understand the importance of hearing health. And I'm excited because my colleague and friend and team member is joining me today. Terry, I'll kick it to you.
Thank you, Teresa. My name is Terry Zwollen. I'm one of the newest members of Hearing First, and I joined recently, and I'm an audiologist. I have a doctorate in audiology, and what I hope to bring to Hearing First is just more information for both professionals and families to partner with speech language pathologists and professionals in the hearing field so that we can improve the outcomes that we see with young children with hearing loss. So we're hopeful today we can answer some good questions and take you along that journey with us.
Awesome, thank you. And thanks for all you do. We're excited for this conversation as well. If you guys are ready, I'm just gonna dive right in. Like I mentioned, we collected questions from our Baby Center community, so I'm going to read those now. The first one is, can repeat ear infections cause a speech delay? My son is 16 months old and has a speech delay, and if he doesn't pick up more words soon, he'll start speech therapy.
Yeah, that's a really great question. And I think that's a very common thing that many families run into, that their little one has ear infections. And yeah, ear infections can cause a speech delay and a language delay in children. And it's kind of like the reason why is because when you have fluid in the middle ear space, then you're not able to hear all the sounds of speech clearly, and you may not be able to understand what words are being said. So it does impact that child's ability to develop their speech skills, to develop clear articulation of all the sounds of speech, but also to understand language and understand spoken language and to develop their own expressive vocabulary. So the good thing is that getting connected with a speech language pathologist, getting enrolled and having evaluation and starting intervention services, it really does work. And the earlier you get started, the better those outcomes. And many children experience the delays because of middle ear fluid, but acting quickly, getting the fluid cleared up medically, getting started in intervention, and they would have very high success.
That's great. This is a personal thing for me as well. My daughter has had repeat ear infections for the past year or so, even after ear tubes. So it's great to hear that there are always options, and just making sure we stay on top of it is super important. Well, I will go on with the next question. This is a question about the newborn hearing screening, which is a test that all babies should receive after being born, usually at the hospital for most babies. My son didn't pass his first hearing screen. Everyone at the hospital keeps telling me that it's normal and probably just fluid, but I'm worried sick until he has a follow-up with an audiologist. What are the chances he has hearing loss?
So I'm going to jump in on that one, Olivia, and say this is a great question too. And I'm really happy that someone asked this because we do hear this a lot from parents. I think professionals are well-intentioned when they tell new parents not to worry. And it's true that fluid in the ear, as Teresa just mentioned, that can be the reason that a child fails a hearing screening. If the child has normal hearing, once that fluid's gone, we'll be able to see that they have normal hearing. But my biggest concern with telling parents not to worry is that for some parents, it somehow makes the hearing test seem non-urgent, and they might put it off, or they might feel it's less important, and that might make them less likely to follow up promptly like they should. So I do think it's important not to worry, but I think it's more important to follow up promptly, because doing so makes it possible for us to treat that hearing loss sooner. And treating the hearing loss makes it much more likely that the child will have a good outcome. I think you'll hear that theme from us throughout today, that early identification, early treatment are really the keys to success. Just one other last thing to add is in regards to the last part of that question regards what are the chances of a hearing loss, is the CDC tells us that anywhere from about 2 to 10% of babies in the US will fail their newborn hearing screen, but less than about 1% will have permanent hearing loss. So although the chances are very good that this child will not have a hearing loss, it's still very, very important for them to follow up with that hearing screen.
Thank you so much. That's so reassuring. And, we always like to hear some stats. Those seem, as parents, they make us feel a little bit more comforted. So thanks for sharing that. Our next question, a lot of new parents have asked this on our community boards. My 2-month-old baby doesn't respond to loud sounds. I'm worried she might have hearing loss. Are there other signs I should be looking out for?
Yeah, so I love this question from this mom because it really tells us that she is in tune with her baby. And the first thing I want to say to moms is never doubt your mommy gut. And what I mean by that, if you have a concern, it's important that you talk with your pediatrician or that you follow up with an audiologist or a speech language pathologist. And I love it that you're paying attention to this baby and you're so in tune. So the kinds of things to look for is I would advise this mom to watch how their baby reacts to sound, environmental sounds, that when their baby doesn't see maybe something dropping loud on the floor, do they startle? Do they stop what they're doing? If mom starts singing and the baby doesn't see her face or her mouth, but the baby starts jigging or stops moving, when they start hearing music singing or music play, that would be another indication to look for that their baby is responding to sound and sound is starting to have meaning for them. And then as that baby gets a little older, of course, about 9 months of age, we're saying wave bye-bye, and that baby will start telling us bye-bye. Or when mommy starts talking, the baby might turn to look towards mommy. And when daddy starts talking, turn to look towards daddy. Or if someone's coming in the room and they announce and talk before the baby sees them and they get really excited or react, those are all nice indicators that baby is hearing and hearing sound. I think the other thing that happens is that we want to make sure that we need to listen to the baby. What sounds are they making? Are they beginning to coo and babble? Those beginning sounds are typically vowel sounds, and lots of different vowel sounds of ah, oohs, ees start to develop. And then they might start putting syllables together, where it's ma, 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 ba, 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 that type of babbling. And then we start seeing first words emerge. And typically around 12 months of age, that baby should have 10 to 12 beginning vocabulary words. But I want to just say at any point, whenever you are worried that your baby might not be hearing, get to a pediatric audiologist, have your baby's hearing tested, because sometimes baby's hearing can be mild, sometimes it can be progressive, or it can develop over time. But we want to make sure that every baby hears all the sounds of speech clearly through their ears, because that's how we all learn to talk, is by listening to the speech and the language of our moms, our dads, our siblings. And so hearing is about brain development. And so if you ever have a hesitancy or you're unsure, follow up. It never hurts to get evaluated and get tested just to make sure.
Going back to that mom intuition there, please get things checked out. Can you just briefly go over, I know you mentioned 12 months, 9 months. Is there anything right at the beginning? Are we talking about right at the beginning? We can even start to evaluate our child or just start to notice things our child is doing right off the bat. How early can we start looking into that or being aware?
Well, there's observations that we can make, and then there's physiological testing that we can also do. But in terms of observations, all babies have a startle reflex to loud sounds, typically, babies with typical hearing. My oldest son loved seeing, when my youngest was a baby, he loved tiptoeing into the baby's room and making a loud sound or making a whistle to watch the baby with his startle reflex. But that isn't always the very best test either, And Terry, I kick it to you if there's other things that you think we should look for in newborns and how you might test newborn hearing.
Right. So no, I would agree with you. The startle response for very young babies is really the best thing for families to look for. And a baby that's born with a profound hearing loss won't have the startle response. So it's an important thing to look for. But we'll start to see more things as the baby ages. And the important thing to know is we can test newborns' hearing and get a very effective, very reliable test within a few days. If that wasn't possible, then we'd have to wait, but there's no reason to wait because we can do these tests while babies are sleeping. They're not painful, they're easy to do, and they're very, very effective. So we work with moms and dads, and we work together, and we can really get a very good hearing test on those babies.
It's good that it's when they're sleeping, because otherwise I think it would be very difficult to get an accurate reading with all the squirming. So I'll go on to our next question, which is from a worried mom thinking she could have done things differently. My baby just failed his second hearing screen at a week old. I'm being referred to an audiologist, but I'm worried that I did something wrong while pregnant. Is there something I could have done to have a different outcome?
Well, I think every new mom has worries like this. Should I have done something different? And it's a great question to be asked today because we have expectant moms listening. And it's important for them to know that there are things that they can do that it will make it less likely that their baby might be born with a hearing loss. So, for example, we do know that children who are born prematurely or with low birth weight are more likely to have a hearing loss. And we also know that there are certain behaviors that expectant moms can do to reduce the chances of prematurity or the chances of their baby having low birth weight. So some of those things are to not smoke, to not drink, to not use drugs. And all of those things will help them have a happier, healthier baby and decrease the chances that their baby will have a hearing loss. Sometimes that hearing loss can be caused by other factors. Sometimes the mom might be exposed to infections while she's pregnant that are then passed on to the baby. Sometimes the baby might be exposed to certain infections once they're born. And then another big cause is genetics. About half of babies who are born with hearing loss are due to a genetic cause. So I would say that overall, the best thing that expecting moms can do is stay as healthy as possible and try to decrease the likelihood of early delivery, and really do everything that they can to just have a healthy, happy baby, because that's really what everyone wants.
Yeah, and if I could just add to that, Olivia, I think that most babies who are diagnosed as deaf or hard of hearing, that baby is born to two hearing parents. We know that 94% of babies born deaf or hard of hearing are born to two hearing parents. So it does come out of the blue. And and never in their wildest dreams did they think or imagine that they might have a baby that had hearing loss. So I think it's important that we as moms sometimes can beat ourselves up or wonder if it's something that we did. when that isn't necessarily always the cause. It doesn't first, we need to let ourselves off the hook with that. The most important thing is to focus that energy and that effort on getting that baby the hearing diagnosed, and then navigating along with a team of professionals what those next steps might be. You don't have to do it alone. That's the most important thing.
I love that so much. As a mom, I still worry about every little thing, but especially during pregnancy, I had a challenging time getting pregnant. So of course, as you enter pregnancy, you question everything you're doing. So that was really helpful to hear, and great tips. We, of course, at Baby Center want all pregnancies to be the healthiest that they can. So this is just another element of that. Thank you so much. Okay, so the next question is it common for a newborn to fail a hearing screen in one ear but not the other?
I really like this question because it shows that these parents are really thinking about what those results are going to be like. And when the hearing screening is performed, we do look at each ear by itself. And it's estimated that about 1 in 1,000 newborns will have a hearing loss in just one ear. And it's important for us to know about this early on, because just like if a baby has a hearing loss in both ears, the hearing loss can result in delays in speech and language, sometimes delays in social or emotional maturity. It can impact the child's behavior, and it can also impact their academic success in the long term. So we also know that hearing from only one ear makes it really difficult for children and adults to hear in background noise. And we know classrooms are really noisy places to learn. So if someone has a hearing loss in one ear, we want to know about it to help them be more successful in preschool, in grade school, and in classroom and in general. And they also have a hard time telling the direction of sound, because with 2 ears, that's what gives information to our brain to tell us what side of our head the sound came from. So sometimes that poses a safety issue for young children if they're only able to hear from one ear. So it's really important for us to know about hearing from only one ear early on. And it's also important because the number of children with hearing loss in one ear, it increases as children get older. So that number grows to every 3 in 100 by the time these children are in school. So again, there's things that we can do to treat this. We want these children to be successful. We want to identify it, and that hearing screening is just the beginning. And it starts us off on being able to make a difference for those children, even if they only have a hearing loss in one ear.
Just goes back again to getting everything checked out early and just being proactive as a parent. I think it's so important. Okay, so the next question is actually from a parent whose child has been diagnosed with hearing loss. And she says, my 3-month-old has been diagnosed with mild hearing loss and will likely need hearing aids. What should I expect? And do hearing aids have any social development implications?
Well, again, this is a terrific question from a mom who is thinking ahead in that Rolodex of life, all the life experience that she wants and hopes and dreams for her baby. I think the other thing, it will really depend upon how this family navigates it, how the family talks about the hearing aids, to recognize that some of us wear glasses, some of us wear hearing aids, some of us need glasses to help our eyes, and some of us need hearing aids to help our ears. But really equipping that child with, this is just like daddy or grandpa puts on their glasses, that how that family navigates it, how they talk with their child, how they equip their child to learn how to put their own hearing aids in, how they learn to explain or tell other people about their hearing loss or why they wear hearing aids. The great thing is right now is that ear candy is pretty sexy. Everyone walks around with cool things. So it really happens where most of these children, when they go to preschool or kindergarten, everyone wants one of those because it's the cool thing to have. And if you teach your child that, when kids, and others ask you, what are those? Oh, these are my hearing aids. They help me hear. And they're equipped and ready to answer that. It helps them grow in that socio-emotional development. So I think you're tuned in. We do want to be concerned about the whole child. But I think how we along through the years, how we equip that child with the words they need, how they feel about their devices, and that it's a part of them, that sets them up for great success and great development. Terry, I don't know, do you have anything else you would add to that?
I would say again that early intervention, we find that children who get that intervention early tend to have less issues with it. It's just part of who they are. They enjoy hearing. They don't really think twice about using their hearing devices. So again, they adapt much better than parents might be worried that they might, but they put them on and they love wearing them, and it's a part of who they are. So it's very important, again, that early use for so many different reasons.
I love those tips so much. I mean, empowering our children, educating our children, and just building that confidence. Like Dr. Caraway said, it could be the cool thing to have and to do. So I think it's really great to just be positive about the whole experience and just educate them, I think is great. And so we're going to get into the next question. It's from a parent whose child is deaf. She says, my little girl had her final hearing test and is severely deaf in both ears. The doctor is working on hearing aids now, and we have to make a decision within the next couple of months if we want to pursue cochlear implants. Anyone out there with suggestions or experience in this area?
So I'm going to snag that question. I actually worked as director of the cochlear implant program at the University of Michigan for 30 years before coming to Hearing First. And I've encountered so many families like this, and it can be such a scary experience for parents when they first step in that clinic door. But all I can say for this mom is it's great that she's taking action so that her baby can have the best possible outcome, and she's recognizing that early is really the key. As we've heard from some of our questions, time is of the essence. And at this stage, the best thing that this mom can do is help her baby adjust to use of the hearing aids, because that's an essential part of the process. Even when they don't provide that much sound to a child with a significant hearing loss, getting used to those hearing aids is so valuable and so important for that family. And even though it might feel like, wow, but my baby just got hearing aids, why do I need to be talking about cochlear implants? It's important for this family to connect with a cochlear implant program so they can begin to learn more about cochlear implants, so they can learn to explore and learn new things about them. And it's important for them to know that the evidence is very clear that cochlear implants are safe, they're very effective for babies. Even the FDA recognizes this. Cochlear implants are approved for children as young as 9 months of age. So 9-month-old babies are receiving cochlear implants. And I think that's a strong sign that the FDA recognizes how important this early intervention, providing early hearing to this children is. So I would encourage them to meet with a cochlear implant program, learn as much as they can. And I would also encourage them to start to navigate to find a listening and spoken language specialist, and even start working with someone before their daughter receives cochlear implants, so that they can be prepared right out of the gate and start, working as soon as their baby receives improved hearing. The last thing I'd like to add is that Hearing First has a wonderful family community. A lot of times families like this really want to talk to other families who have taken this journey ahead of them. And families can find additional information on the Hearing First website at hearingfirst.org, where they can connect with other families that are going through similar steps.
That can be so beneficial, really, for any parent issue or child issue. Just connecting with other parents who are going through the same thing, I think, is so important. And then just the importance of reaching out to your medical professionals. It's great to have a medical team, as I like to call it, for our kids, just no matter what the issue is. I think it's great to just lean on them. That's what you guys are there for. So it's great to hear you say all of that. Our next questions kind of contrast each other. So one parent asked, our baby didn't pass the newborn hearing screening. My husband and I don't have any family history of hearing loss, and we're not worried about our baby's hearing. Do we need to follow up? Another one of our parents asks, my daughter passed her hearing screening, but she is not turning to sounds at home. Should I get her hearing checked?
So I think we do have these dilemmas, right? Oh, I don't think there's a problem. I'm not going to do anything about it. Versus, they tell me there's not a problem. But I think there really is one. And I go back to Teresa's earlier statement about the sort of the mommy radar. I always listen very closely to parents. And even if my test results aren't in agreement with what they're telling me, I'll do it again because I really put so much value in what the parent has to say. So I would recommend that the mom who has concerns to take their baby in and really even push the pediatrician. Sometimes the pediatrician might say, don't worry about it, give it some time. But I think when a mom's on top of it, she should definitely take action. And then I'll pass it over to Teresa if you want to answer the harder part of that.
Yeah. So I think, anytime that a baby fails the newborn hearing screening, and like I said earlier, it usually comes out of the blue. It's usually not even on their radar that their baby is going to have their hearing screened. And that's why we have the Starts Here campaign to raise that awareness, to be prepared for it. So anytime that a baby fails the screening, it is critical to follow up. And the reason for that is because we think hearing is about the ears, but it's really about the brain. It's about language. It's about information getting to the brain. And if that doorway to the brain or the ears, if it's blocked, then that means the learning and the knowledge all around your baby, even from day one, is not getting to that little brain. And we know that the first 3 years are so critical for speech and language and cognitive development. So if you're going to err on something it'd be better to take them in, follow up, and say, I was right, rather than the opposite to happen. And when that child becomes 2.5, 3 years of age, and now we're not seeing the speech and language develop like it should, now we're behind the 8 ball in terms of remediating and catching that child up. So you don't ever want to get behind. And we want to stay in step when that little baby's ready to learn, ready to grow, and ready to do all the things that it's been created to do. So I would say, go and prove the screener wrong. Get the full.
I love that. I think it's so worth mentioning that just, keep following up. If you think something's off, always go into the medical professionals and have them take a look. And if you get that negative test, I think it's really important to just keep following up and keep helping your child. And again, prove the doctor wrong. So our next question is a probably not simple one, but is hearing loss genetic? I have a family history of hearing loss and I'm worried about my baby getting it too. I think a lot of parents have this question.
Mm-hmm.
As we reviewed earlier, there's many different causes of hearing loss, and a family history does increase the chances that a baby might have a hearing loss. But having a family history does not guarantee that a baby is going to have a hearing loss. But it's really important for parents to be aware of this and to share this information with their pediatrician, with their hearing professionals. And the reason for that is, oftentimes children with a genetic cause of hearing loss will have a progressive hearing loss, one that sort of just gets worse over time, or one that's delayed in onset. So those children will likely pass the newborn hearing screen. Parents will think everything's okay. But if you're aware that there's a family history, you might be more diligent in following up and saying, you know what, I better get this checked again later on, just in case my child has a progressive or a delayed hearing loss. So I think education is really power. Sometimes it's viewed as scary, but it really should be viewed as power because it empowers you to do the right thing, to make sure that you take action when you need it. So knowing they have a genetic loss just puts you into a seat with a little bit more power so that you can take action and you can really take care of your baby sooner rather than later. So yes, it can be due to family history, but that shouldn't be quite so scary.
That brings me to another question. I think it's just so important to document any family issues or loss, especially as your child ages. But can you explain a little bit about the hearing test? Will kids have them as they age? You're talking about delayed hearing loss. When could we expect that to show up? And kind of what does that look like if, everything tests out great at the newborn hearing screening? how would we know something's off, or would there be another test later on?
So there's two big parts to that. So I'll start with part one, and then I'll hand it over to Teresa for part two. And this is why I love our partnership, because we're the model of two professions that work so closely together for children with hearing loss. But typically, if a child passes a newborn screen and the parents don't have any concerns, they probably won't get their hearing screened again until maybe preschool, or even sometimes as they enter grade school. But it's really important for parents to stay on top of it and alert their pediatrician, or actually go seek out an audiologist all on their own if they have concerns about the hearing loss. And then our partnership with speech language pathology, Teresa, maybe you can speak to that as to what parents need to look out for.
Yeah. So I think, we kind of had talked about that a little bit earlier, that, I would get at Hearing First, we have a milestone chart of what to expect by ages and stages, what babies should be doing. And that's a really great guide for families to look at. And if they start seeing that their child, or have concerns that their child isn't doing or meeting some of those milestones at those ages, or they would like help evaluating and observing, is their child meeting those ages and stages, then I would be seeking out a speech language pathologist to have a consultation with, to perhaps do an evaluation, to perhaps look at this, the milestone chart with me, and for us to put it in perspective and see what is going on, but also to find out as a mom what I could be doing to help stimulate that growth, to help that, to do special or little things that I could do that really would help my baby reach the milestones that they're scheduled to reach at different ages and stages. But I think the bottom line, I think I feel like we're kind of a broken record, and that is that if you're ever concerned, always seek evaluation. And one of the things we know that happens to families, they may have a concern that their baby does have hearing, they passed newborn hearing screening, but they have a concern that their baby isn't hearing because, at what they're observing. And they may go to different professionals, and different professionals may say, don't worry about it, they're not old enough yet. I would never take that for an answer. In other words, if a professional's telling you that and you truly have concerns, I would go to the pediatric audiologist and ask for a hearing evaluation. There have been numerous families and children through the years. That is the story that I've heard, that they became concerned at 1 month, 2 months of age when their baby, they waited, they were told to wait, that they were just being over concerned parents, or they were just being alarmists. Or that the baby wasn't old enough to test, which is not true, as Terry mentioned earlier. And what happens then is that as those families persevere, at 9 and 10 months of age, their child is diagnosed as having severe or significant hearing loss, and they recognize it or had been trying to navigate it since that baby was 1 or 2 months of age. So if you get an answer that says, let's just wait and see, bypass and find that pediatric audiologist to do that full, complete evaluation for you, so that you can mark that off your list and know how to navigate.
I love that. Being your own health advocate for both yourself and your child is really important. So keeping after it if you think something's off. I love that. This is our next question. Our 6-month-old was just diagnosed with a moderate hearing loss, but I'm having a hard time believing the diagnosis because he seems to hear just fine. Could the diagnosis be wrong?
All right. So it can be very confusing for parents when their child receives a diagnosis, when they see them responding to some sounds. And there's so many different diagnoses with hearing loss. And you had asked earlier about how we test hearing. And when we test babies' hearing, we get a real good feel for the softest sounds they can hear at low pitches, at mid pitches, and at high frequencies or high pitches. So what we find is that someone might have a hearing loss. Let's say they have normal hearing for the lows. They might have a significant hearing loss for the mid and high pitches. And what would happen in that case is a child might respond to some low pitch sounds because they can hear them normally, but they're going to be missing some of the other sounds. And the mom might say, my child turns every time that dog barks. Like, they told me that he has a significant hearing loss, but I don't believe. But it's because maybe the pitch is what they hear, and then there's pitches that they're missing. And what's so important is that we need to hear all of those pitches clearly in order to be able to develop normal speech and language skills. So we really want to be able to maximize the ability of the child to hear so that they can develop spoken language skills. And if, let's say, they hear just those lows and they're missing those those high frequencies contain such important information like consonants. And if they're missing the consonants, they're going to miss the meanings of so many words, so they won't be able to hear it well. But that also means they won't be able to produce those sounds well. So it's going to impact what they hear. It's going to impact how they sound. It's going to impact so many different things. And we're going with this theme of, taking your own initiative. And I would say that if you never believe, or if you don't believe the outcome of a test, it's really always okay to even go for a second opinion. And I think it's really sort of taking charge of your child's health to do that. And if you're in disagreement, go for a second opinion from a different audiologist. Ask the audiologist to explain the audiogram to you so you understand the sound that your child is hearing and the sounds that they're missing. And when you go for that a second opinion, it's so important because you really need to feel confident about the professional that you've seen, and you need to feel confident about the test results that they've told you that they've had. So again, it's empowering those parents to who know their child better than anybody to do the right thing and to take action, even when they sometimes don't get the help they need to do that. But there's resources out there, and they can always make it happen.
Terry, if I could just add to that, agree with all that you've said. As you were talking, I was thinking about the Familiar Sounds audiogram that we've just developed at Hearing First, and the ebook that describes and has everything in a parent-friendly way of what you need to know and understand about your child's hearing loss and understand about that audiogram. It'd be a great resource for this particular mom to read, and to also sit down with her pediatric audiologist or her interventionist to say, I want to talk through this thoroughly of what this means for my child. What can they hear and what can they not hear? And like Terry said, those high frequent, there's information. If children are missing some of the sounds of speech, like S, they don't hear S. Well, it's only plurals. They wouldn't understand if someone was saying cat or cats. They wouldn't understand if someone was saying mommy's sock versus mommy sock. So those markers are so important to understand language, but they're also important for reading and for academic development. Because if you don't have that spoken language, if you don't understand it, if you can't produce it in your own speech, that's what we take into learning to read. So that's why the urgency of making sure a child has access to all the sounds of speech as early as possible is critical, because we want to set them up for academic success.
That's such a good reminder, and I think that's a great resource. Maybe we can put it in our video notes or caption. This has been so fun and so informational and helpful to these parents. I'm so glad they were able to ask questions and we were able to answer them. Do either of you want to share any final thoughts, maybe anything that we didn't cover already today?
Well, I think this has been great fun. And of course, as a speech language pathologist, I like lots of words. I like talking. So we could just stay on all day, and that would be great with me. But I do want to say that I think that there's a couple of things. Hearing is important for brain development. And it's so important. Your baby's going to have its hearing screened. It's so important, if you ever have a concern that your baby might not be hearing, that you need to follow up and go get your baby's hearing tested. That never hurts anything to go for and have your baby evaluated and their hearing evaluated. It will empower you. You know your child best, and never doubt that you are the expert on your child. And Terry, what would you have to add?
Well, I would say that kudos to all these moms that are looking into this important factor so early. They're being proactive. They're taking care of their baby before their baby's even born in many cases. And And I would say also that we live in such a fortunate time. As someone who's worked in the field for 35 years, we didn't have all the technology then that we have now. We didn't have the capability to do such effective hearing tests on babies that we have now. So embrace that, take advantage of it, because there are so many things that we can learn, and that we can treat so much sooner than we could before. That it's just such a great technological time to have a baby, and to have access to all this important medical treatment that's out there.
Yeah. And I just want to say a special thank you to Baby Center and What to Expect in terms of all that they do to provide information, to empower moms to to navigate all that they need to navigate and to learn and grow. So thank you guys, and thanks for hosting us today.
Yes,
of course. This was so fantastic. Thanks again to Hearing First, and a big thank you to Dr. Caraway and Dr. Zwollen for being great partners. We're raising awareness around the importance of hearing for brain development, language skills, and learning. If you have a child who has hearing loss, visit hearingfirst.org for more resources, information, and support.